In the morning, they wake up and they feel as if they have not rested at all. They feel like going back to bed. Unfortunately, they still have to go to work or do some other things. Appetite changes, they lose appetite. And over time, weight loss occurs in them. Irritability, especially women, when they are depressed. Akoramomo, wakoramoko, wakoramo co-workers, wakoramo àwọn. So irritability is a very prominent feature of depression. Poor concentration. Okay? Sometimes we see some people moving on the road and they will be pressing on for them. And they are just there. They have lost concentration. Some of these people may have underlying mental health conditions. Sometimes those that are married are in school or doing one program or the other. They may be in class, and for 10 minutes, the lecturer is talking, they are looking at the lecturer, and they can't just pick any single thing the lecturer said because their minds are not there. Then we have what we call the somatic symptoms. These are symptoms that mimic infections or other physical disorders. Examples, headaches. They describe these headaches as located in one part of the head. Okay? Heat or purple sensation. Sometimes they will describe feeling heat. That is, around magbonola tenungbami. And they will tell you that they touch their body outside. It is not hot. You just feel the heat internally alone. Or peppery sensation, karamatanya all over the body. But you can't pin down anything. That's why when you go to the market, you see people mounting microphones on cars and they will tell you, Awoka, Orishirishi, that you should come, there's a medicine for it. Na scam. There is no way you go to the markets. I said earlier, who are mostly affected? Males or females? Females. Who are those in the markets mostly? Females. So these people will always sell. They know that very well. People will have these symptoms, and these symptoms are not due to any physical complication. They are primarily due to what? Depression. We are not talking about depression only today, so we'll move. Next slide. Now, the second one, anxiety disorders. Also very common, but often misunderstood. They may present with physical symptoms, and they are frequently linked with fear-based beliefs. What are the features? Excessive worry. They worry too much. Even sometimes they worry about things that are yet to occur. They have a child who is just 5 years old, and they are already worrying. You are worrying about person is going to marry, a 5-year-old is going to marry. Okay? Their fear sometimes is unjustified. Restlessness, palpitations, insomnia, that's sleeplessness as well. They have over-concern about sin. Okay? Will Allah forgive me for what I have done? Whereas Allah continuously says that He is what? Agafur Ar-Rahim. Most forgiving, most merciful. But they will not read that part. They will focus more on those that do this are going to hellfire. Punishments or social judgments, they are bothered about all this, forgetting about the aspect of mercy which Allah has promised us all. Sometimes these people, they what we call OCD, some of us know of this, that's obsessive compulsive disorder, also falls under anxiety disorders. We have generalized anxiety disorders, we have the phobias. Okay, I'm sure if I ask some of us here, we have some specific things we are afraid of. My sister, what are you most afraid of? Spiders or mouse? Rats? Lizard? Okay? So sometimes these fears are excessive. out of proportion to what is triggering this fear. That is when they become an anxiety disorder. So it's not everybody that's actually afraid of lizard that has a disorder. Don't get me wrong. But once the fear becomes excessive, there's a lizard over there, and you are here, and you are running this way. Okay? The thought of seeing a lizard is already giving you fear, palpitation. That's when it becomes a problem. So don't get me wrong, okay? You don't have a disorder, okay? So, marital and family conflicts. There's a very strong link between marital problems and mental illnesses. I'm very happy Amir mentioned the fact that they discussed about marital problems yesterday and everything and solutions, which is going to make my work very easy today. There's a bi-directional relationship between these two. Mental illnesses could result to marital problems. Marital problems can result towards mental illnesses. We'll talk about them. We will not talk about the risk factors later on. What are the features? What are the presentations? Frequent arguments. Always arguing. Abu and are always fighting. Emotional distance. Ladies call it what? The silent what? Treatment. Okay? Angry, you don't talk to one another. And there are 3 days. Abu, your food is ready. You may not even mention your food is ready. You will eat, stand up, leave. Every other thing, they are in the house and they are emotionally what? Distant from one another. This will progress towards domestic violence. The next one, substance use and other addictions. Other addictions, unfortunately, there are some addictions that are becoming a problem, even among Muslims now. Internet addiction, gambling, porn addiction. These are all problems. We all know about alcohol and other drug use. Unfortunately, because we all know that it is not permissible in Islam, so people hide all these activities from others. What happens eventually? These people, they may neglect their religious duties or family responsibilities. Take for instance, everybody is at home, everybody have their own gadgets, father, mother, the siblings. For 10 minutes, there may not be a single word from anybody in the house. Why? Everybody is glued to their gadgets. Some people do not sleep early at night because of what? Social media. Unfortunately, these things are addictive. You get home at night. Let me go check my messages on, which one on TikTok, WhatsApp, which one again? Facebook, Instagram, Twitter. You want to check for 10 minutes. I can assure you probably spend how long? 2 hours. Someone said 2 hours. Or longer. You know, it's 12 o'clock. Time to go. Let me sleep. Before you know it, there's no way you wake up for tahajjud. It's not likely. Even if you wake up, you'll be feeling what? Very drowsy. So these are becoming serious problems. Next slide. Psychotic disorders. Examples, we have what we call schizophrenia, and we have what we call bipolar disorders. Manifestations, hallucinations, that is when people hear strange voices, okay, of people they are not seeing, or seeing strange things not seen by others. Delusions may also occur. These may be delusions of persecution. That is, The alágbájá ló ń ṣe mí o. Okay? You believe people are against you, they are trying to harm you one way or the other. Delusion of grandiose. Feeling of self-importance. Oh, you can imagine a sister here saying, I'm the most beautiful sister in this world. Nobody has told us to, but she believes it that she's the most beautiful one in this world. Or someone saying, I have $1 billion in my account, and there is no proof to that. A quick story. A woman went to a bank. She wanted to withdraw money. She put in a check for ₦1 million. The cashier looked at it, went to her account, discovered that she had only 10,000 naira in her account. The woman was so convinced that she had ₦1 million. But the cashier was telling that, Madam, hey, no one bank. He said, what's wrong in the bank? And he said, someone was thinking of money. Of course, if you were the one, you're so sure you had money, what will you do? You want to make trouble. Unfortunately, you want to make trouble with the bank. You are in trouble with them. They called the security on her and she was taken away. That is grandiose illusion. Jealousy, very common among men. They have these thoughts that perhaps their spouse is cheating on them. But there's no proof for that. There's no proof. They haven't caught out with anybody. They have searched their phone. There's no evidence for it. But they are still convinced. At times, they go to the extent of trying to sleep unaware, trying to find out whether she has been with someone else. It's a delusion of jealousy. But of course, we also have a delusion of love. This is common among women, whereby sometimes they feel someone who is of a higher social status. Let's take for instance, someone, a sister, believes the Amir is in love with him, with her, is in love with her, but Amir is too shy to propose to her. So anytime Amir is giving a lecture or is giving an address, and Amir does this, that means Amir is referring to her. That's okay, I've not forgotten you, I'll still see you later. She's so much convinced about this, and she stops the Amir. Anywhere I go on the program, she will be there. Even if it is outside Lagos, she will be there. Because she believes Amir is so much in love with her. But Amir is too shy to express his love for her. That is what a delusion of love. Now, the person who wants to call is organized behavior. Social withdrawal, people withdrawing from others. You see them, they stop coming for programs, people to themselves, physical aggression, common misconception, like I said earlier. Once people develop delusions or hallucinations, we start ascribing them to gene. Okay? That person is possessed, or has seal, evil eye, all these things, whereas most cases are due to medical conditions. Let's select this. Now, children and adolescents are not let out in family. They are not. Okay? Unfortunately, they are often overlooked. Most of the time, we don't identify that these children are having mental ill health. And symptoms they exhibit are different from what we see in adults. How do they manifest? It can manifest with behavioral problems. A child suddenly becoming very stubborn. Mommy, Mommy, I can't do this. That's changing in their behavior. Academic decline. Their performance starts declining. And so maybe 1st to 5, now 11th position, 20th position in school. They may also have depression or anxiety disorder. Yes. But sometimes the presentations may differ. For instance, an adolescent presenting with anxiety disorder may be mistaken for asthma. Yes, a lot of cases have been misdiagnosed as asthma, and they have been given medications for asthma for years. Because once they start, suddenly they become very fearful, palpitations, breathlessness, because they have this sudden fear which triggered it. Sometimes it could even be in an exam hall. We had a case like that, entered an exam hall, it was mathematics exam, opened the question, saw the questions, the next thing, panic attack, became very breathless, fearful, palpitations. They had to rush the person to the hospital. And they felt it was asthma. They started giving inhaler and everything. Fortunately, they ended up in our unit as well before we made the correct diagnosis. So their presentations differ from adults. Domestic violence, okay, and emotional abuse. There's something we call intimate partner violence. This comprises of what? Physical abuse, emotional abuse, as well as sexual abuse. The ones we commonly talk about are the physical abuse. Unfortunately, the most common among them is the emotional abuse. Okay? The emotional abuse. This is a major mental health problem that people go through. Unfortunately, they do not talk about it. Violence against women, to the best of my knowledge, is clearly prohibited in Islam. How do they manifest? Physical harm, emotional humiliation. You are in a gathering and a man is talking to his wife as if he's talking to the house girl, and people will be like, what's the usual thing? You say, hey, what's your own? You have to mind your business. Okay? I was somewhere and the lady wanted to give her husband something, maybe biscuit or something. The guy said he was hungry. And he threw the biscuits. Okay? So it's not only men to females. Men also experience it from females. Fear and helplessness. Once this starts, one of the features that people present with is helplessness. They have this feeling of learned helplessness. There's nothing I can do about it. And they are fearful. They are fearful about the person who is carrying out the abuse against them. Now, we talk about the risk factors. We'll talk about the risk factors. Why do people develop these illnesses? It's a big question. You have what we call general factors, which we just go through briefly. Genetics, yes. I remember one of our sisters asked about whether mental illnesses can be heredited last year. I don't know what the person was. I remember someone asked this. Yes, there's some genetic predisposition to mental illnesses. Research has shown that if a couple, that is both parents, have a particular mental illness, that the chances of the children developing the illness is as high as almost 50%. Yes, that's if both of them have it. Chances of both of the child, any of the children, is as high as 50%. If a twin, identical twin, has the disorder, chances of the second twin also having it as high as 40 to 50%. So yes, there's some genetic predisposition to mental illnesses. Endocrine abnormalities. Okay? If someone has things like thyroid dysfunction, we know the thyroid gland. I don't know what to call it in Yoruba again. This enlargement of the thyroid on the neck, and some other disorders too. We also have features of mental illnesses. Drugs like steroids, Okay? They may also cause some forms of mental illnesses like mania or catatonia. I have to move faster. Not on my side. Trauma, head injury, infection, yes, cerebral malaria in children, HIV, sepsis. These are common things that may cause mental illness. Chronic medical conditions. The spouse has stroke. The wife has been nursing the husband for 10 years. The man can barely move. He has to carry him to ease himself. Thank you. She has to carry him to ease himself, to do other things. Burnout sets in. She's tired. Such people are supposed to developing what? Depression and other mental disorders. Perinatal factors. Okay? Factors that surround birth. That's what we call perinatal factors. A child that did not breathe well at birth, there's a high chance that such a child may develop mental illness in future. Breathing well, we are referring to here, maybe after 10 minutes, Apgar score of just about 3 or 5. Not breathing well after about 5 to 10 minutes. Okay? Connecteros, a child that suffers severe jaundice at birth, they are also at risk of developing these disorders. Slide. Yes, let's look at contributing factors from each of the disorders. Financial hardship. There's a slang they say nowadays, Sapa, or what do they call it? The younger one, Gen Z. Sapa, is Sapa or Shapa? Or, eh? Sapa. Okay. It's not easy. May Allah provide for us all. I can't hear that. May Allah continue to provide for us all. It's not easy. Our bills continue to mount. But the resources to take care of the bills are not increasing everywhere. Marital conflicts. Okay, once there are issues between husband and wife, either of them or both of them can develop depression. Unrealistic religious and cultural expectations. Sexual dysfunction. I believe we are all matured here. Yeah. So sometimes couples may have problems, primarily because the man is not able to satisfy the wife sexually. As simple as it looks, it can be very, very terrible. On the side of the man, his self-esteem goes down. And he sees himself as a failure. As a failure. He goes out there trying to do everything possible, but nothing is working. And he sees himself, anytime the wife is asking, he tries to dodge because he knows that he's not going to be able to satisfy the wife. Over time, he may become depressed and even suicidal. Likewise, on the side of the woman, the husband is not doing well. She understands the religion so much that she knows that if she tries to satisfy herself out there, it is around and it's very punishable. So what does she do? She can't even tell her friends that this is what I'm going through. She can't even tell anybody. So she has to keep it within her that this is what I'm going through. And she suffers it alone. She may also develop depression in such instances. Infertility. It is not easy. Those of us that got married after a year, had the first one, after 2-3 years, second one, third one, fourth one, fifth one, seventh one. You don't know what Allah has done for us. There are some that are battling this. They have spent money, serious money, tried IVF, failed, tried surrogacy, failed. But the word of Allah is always true. Unfortunately. Allah says that we give some. For some we give men, a boy, males. And for some we give females. And some we give what? Both males and females. And for some we make barren. In other words, no matter what they do, nothing will come out of it. But it doesn't mean that they should not try. If they have the means, they should continue to try. May Allah accept their prayers. Because it's not easy. Especially when they are invited for, listen, Ikomo, every now and then. Sister Akiniko, are you coming for the naming ceremony? She starts finding excuses not to go. Why? Because anytime she goes, she comes back home, she starts crying. So these are contributing factors. Next slide. For anxiety disorders, fear-based religious teaching, there are some that hold on to so much, some of this akida. Any small thing, hellfire. Any small thing, hellfire. And for some who are light-hearted, and they are in such gatherings, they are highly predisposed to develop what? Anxiety disorders. Financial pressure again is another factor. Domestic instability. Once there are issues in the family, they could also cause anxiety disorder in the couples, likewise in the children as well. Intimate partner violence, we explained that. I won't go into details again. Poor social support from spouse. Sometimes we brothers, we are mostly guilty of this. Your wife is pregnant, 6 months, 7 months. You still expect her to pound yam for you. You expect her to do this and do that. You know, sometimes we brothers, we come back from work together. We observe Maghrib. We are in the sitting room pressing phone. This woman is in the kitchen, heavy, trying to cook, trying to clean up, trying to do this. There's nothing wrong in us assisting at all. Once the support is very poor, they are highly exposed to all these disorders. Narcissistic person. What do we mean? These individuals, they have excessive focus on themselves. They have this inflated sense of importance, and they lack empathy for others. They are what's called narcissistic people. There are some traits that they exhibit. Okay?
10 minutes, I question.
I have 10 minutes more. It's not possible. Okay, let me try and... Okay, so narcissistic people, this is very important because we have people that have this kind of personality amongst us, sincerely speaking. They have this exaggerated self-importance. They have need for admiration. Next slide. Next slide. They lack empathy and they are very sensitive to criticisms. They react poorly. When they are criticized, they become very angry. Very angry, and then they become violent at times. Next slide. How does this affect our families? When one person is one-sided, okay, they have little regard for the feelings of the other person, either males or females. So there's a highly unbalanced relationship where one person is always giving and the other person is just taking. He's not giving back. Unfortunately, they are always criticizing the other person and blaming the other person for everything that is happening in the family. Next slide. They like to control the other person. Very manipulative people. Very manipulative. They devise various means trying to manipulate the other person and always trying to gaslight them, blaming them for everything that happened in the family. They can be very jealous, and sometimes their push for a better spouse, in quotes, is what makes them leave the marriage for someone else. Not because of anything. They believe this person is not good enough for me. So what do they want to do? They want to leave the person and go for another person. Next slide. Okay? Emotional and physical abuse. They are the kind of people that resort to abuse of their partners, and sometimes, which also happens, they try to badmouth other people in front of their spouses. So, to isolate their spouse from these people. And possibly, these are the people that may help, that may want to listen to this person's problems. So they create a false narrative. Brother, bye. So the sister does not want to relate with the Amir anymore. And the Amir is there to want to assist in solving their problems. Amir must survive. So these are narcissistic people. So they want to isolate their victims from other people. Next slide. Substance use disorder, we all know this, peer pressure, emotional distress can push some people into taking alcohol and other substances. Secrecy and shame, next slide. Complications that may arise from all this. I have to be faster now so we can move to solutions. Complications, suicide. I'm sure we've all heard stories of people that committed suicide because they were having problems in their homes. Homicide, killing someone else, either intentionally or unintentionally. Once there is marital discord or domestic abuse, you may just want to hit the person innocently. Go to a man, the next thing the person slumps and dies. It has happened a couple of times. So these are real. May lead to imprisonment, functional impairment. When there is fights in the home every day and the children are witnessing this, the child gets to school, is not able to concentrate anymore. What happens to the academic performance? It dwindles. Loss of employment. For people that become depressed eventually, they may eventually lose their job. Loss of income from loss of unemployment and other things. Marital complications, emotional withdrawal, irritability, aggression, sexual dysfunction, related to depression, of course. Once females are depressed, they lose interest. Even males, once they are depressed, they lose interest in bedroom activities and there will be problem thereafter. Increased risk of divorce, separation, once all these are happening in the family. Next slide. Poor parenting and child outcomes, emotional neglect, harsh or inconsistent discipline, increased risk of behavioral disorders in the children. Yoruba have a saying, when two elephants are fighting, who suffered? The grass. And who are the grass in this case? The children. The children. Okay, next slide. Religious complications, feelings of abandonment by Allah, excessive guilt and hopelessness. Then interpretation of the illness as punishment. These are things that may occur in individuals. Next slide. Health complications, we may have physical complications as well. If someone has medical complications like hypertension, they may forget or refuse to take their medications. Sleep disturbances, like we said earlier, depression, anxiety disorders, they can cause what? Insomnia, which can be very, very bad. Substance use, self-medication. I think I need to pause here and stress this. Not just alcohol alone. This is very common among our sisters. They start using cough mixtures. To what? To sleep. Cough mixtures with codeine. That's why cough mixtures with codeine are expensive. because ladies seem to take a lot of it just to be able to get some sleep. In fact, soon, even just for 3 or 4 hours. Because anytime they go to bed at night, because they're having all these mental health issues, they find it very difficult to sleep. They wake up with headaches. From cough mixture, they go to what? Billion 5. From 1 tablet, they go to 2. Before billion 5, they go to what? Piritin. How many of us have used Piritin before? I've not used. I'm not saying I've used. I've not used. Only one person has not used before. Okay? So that means most of us have used Piritin before to sleep. Okay? So from Piritin, they go to what? Valium and the likes. And this becomes a big problem because they continuously need higher doses of these drugs. Next slide. Solution. What do we do? We propose an integrated means of solving this problem. Medical treatments, psychological therapy, family support, spiritual care, community involvement. Others, our sleep hygiene, regular physical activity, balanced routines, and reducing isolation. Next slide. Specifics now. Depression, what do we encourage? Psychoeducation. This is one of it. Psychoeducation. We're trying to educate ourselves about all these disorders. That depression is not just an illness, it's an illness, not a sign of weak iman. Okay? Encouraging professional help. Once we see these symptoms I mentioned earlier, it's not all cases that need medical or drugs. Okay? Some just needs psychoeducation or psychotherapy. Spiritual support, dhikri, like we always talk about, our early morning dhikri and evening dhikri. Some of these contain protection from sorrow, from depression, from poverty and the likes. So we encourage all this. Chronic recitation, frequent recitation to try and solve problems. Then we must address the risk factors. There is no way the person will recover if you did not address the issue or the problem causing the depression in the individual. If it is a marital problem, you must address it. Otherwise, the person gets better, goes back to the situation that caused the problem. Next slide. Anxiety disorders. We encourage a balanced Islamic teaching, emphasizing the mercy of Allah. Okay, rather than the punishments. Okay, CBT, that is cognitive behavioral therapy, these are technical things that can be done by psychologists. Relaxation techniques integrated with dhikri. Dhikri is coming up again under anxiety disorders. Very important, very important. You should take it seriously. For those of us that have not been doing it, I encourage us. Let us try. Once you are involved in meditation, reciting the dhikri frequently, you are less likely going to be focusing on the problems you are having, because you'll be convinced that you are handing over the problems to Allah subhanahu wa ta'ala. And by doing that, you'll be more relaxed. That's why we say relaxation techniques. Avoidance of harsh or threatening parental styles. Sometimes we are the cause of the problems for our children. Some parents can be too someone breaks a plate, the normal wire, they feel normal. Will the beating restore the plates? Definitely not. Sometimes we impose punishments that far outweighs the act that was done by the children. Next slide, please. Yes, for marital conflicts and domestic abuse, what do we advocate? Islamic marital counseling. I believe this is being done by, because I'm privy to some information that people that have gone through this before eventually being referred to me at times. Education on mutual rights and responsibilities in Islam, we must know our responsibilities. Sometimes the fact that Islam says that, okay, the man is responsible for providing for all our finances. pay education, provide food, but sometimes our sisters, sometimes we should not overburden our spouses. You know this man earns 200,000. You have 4 kids, and you are imposing it on him that he must. How many minutes? Okay. And you are imposing on this man that your children must go to an expensive private school. I mean, you are putting too much burden. Yes, he may try, but eventually he starts borrowing here and there, and it becomes a burden on him as well. Likewise, brothers, let us try to always be supportive to our wives. We all know that, but there's nothing wrong in a man assisting the wife in doing domestic chores. There's nothing wrong in that. It doesn't belittle the man in any way. Clear Islamic condemnation of oppression, conflict resolution and communication skills, separation or divorce if all fails. Marriage, I always believe, it is not by force. If it is not working, if there's abuse, domestic, physical, sexual, emotional, and you have tried everything to resolve it and it is not working, please, 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 let us know when to do what, when to walk out. It's both ways. If the pressure is too much on the man and the wife is too demanding, you have tried everything possible. Divorce is strongly frowned against, but it is not around. I believe I'm right. It is not around in Islam. It is better to be alive and well, separated, than to end up dead in the house, being married. We've had a lot of cases of people that have been maimed, okay, or killed because of this. Next slide. I think I'll skip this. Let's go to the next slide. Psychosis, treatments, you need drugs, and ruqyah. You see, as medical doctors, we are not against ruqyah. We are not against all these things. But what we encourage is that we should combine it with what? With medications. Allow your children to express themselves. If they do not express themselves to you, they will get advice from outside, which may be very terrible. Once your child is having some concern, let them express themselves to you. Otherwise, it's going to be a problem later on. Next slide. Red flags. Red flags. I'm almost through. Red flags. Once you see that a patient is having thoughts of suicide, of severe self-harm, please let them go to the hospital. These are not cases you start calling someone. The person must end up in the hospital. When the person is having repeated thoughts of harming others, whenever I see my wife, it's as if I should take a stick and hit her on the head. These are red flags. Because eventually the person may do it. Severe confusion, hallucinations, inability to perform daily tasks, okay? Recurrent, persistent physical abuse. These are what? Red flags. Once physical abuse starts, they hardly stop. Once they start, they what? They hardly stop. Next slide. Finally, conclusion. This is a call to action for every one of us. If your partner is feeling sleepy, let them be awake right now. Our homes should be places of sakina, that is tranquility, not a place of fighting. No one is immune to mental illness. Anybody can be affected. Funny enough, the professionals with one of the professions with the highest rates of depression, guess, medical personnel, unfortunately. So nobody is immune. The fact that you are an engineer, you are a medical doctor, does not make you immune from having a mental illness. The key is what? Prompt treatments, We need to break the stigma, normalize seeking help as appropriate. We should show empathy first. Let us all live here today committed to being a support system for someone, either our spouses, our children, our senior family members, even though they may not be having mental illnesses now. But let us try to support one another. Integration, healing comes from Allah alone, but through the hands of doctors and therapists. May Allah grant healing to all those struggling in silence. Amen. Thank you for listening. Sorry for taking so much of your time.
Alhamdulillah. I join the listeners to appreciate our first speaker for taking us through the well-researched topic, especially as it refers to common mental and health issues in our home. Job is job.
that car is going to get old. If you don't use it, it's still going to get old. It's going to age. If you build a house, no matter how beautiful that house is, if you occupy it with your family, it's going to get old. If you leave it and feel that it's still going to get old. Same thing applies to the human body. As we are born, newborn, whether we make use of our body system and organs, like it or not, it's going to age. Like it or not, wear and tear would set in. Like it or not, it's going to start developing issues. So same thing too with that analogy is going to apply to this topic I've been asked to talk about. So from that topic, we will discover that there are three key things there. We have aging, we have emotional issues or changes, and then physiological changes. Now, let's start with aging. I'm sure if I pick anybody at random and we ask what aging is, we'll all readily have an opinion of what aging is. In the layman terms, it simply means the process of getting old. And because we know that the human body is not just the physical, every other thing about it would equally get old, whether it's the psychological aspect of it, the way and would handle psychological issues would obviously be different from the ways a middle-aged person would handle psychological trauma. And also going to be different from the way a toddler would handle psychological trauma. You want to agree with me? A very clear example. If I pick up a 9-month-old or a 10-month-old or a 1-year-old and I give a very dirty spank on the bum, surprisingly, a few minutes later, the child will come running back to you. Now, if you do that to a middle-aged person, his response will be different. So that shows that as we age, everything about us age. Everything about us age. So in the layman's term, aging is simply the process of getting old. While physiological changes are just those interactions that we are not aware of that makes tissues, organs, and system to function effectively so that we can have a healthy body. Emotional issues, emotional changes, emotional challenges. I'm very sure the Prof has talked about it. But if I'm going to add one or two things, I'm just going to say it's more of a psychological challenges that affects the way we think, the way we react to issues, and of course, the way we relate with each other. In other words, these are psychological changes that affect mood, the thought process, and relationship. Excuse me. So, having understood all of these things, it now builds on us to now begin to see what are those emotional changes that can accompany our aging process. But before we talk about aging process, if you are going to categorize aging, we can categorize someone as middle-aged. We can categorize someone as an elderly. And we can also categorize someone as advanced in age. Of these three categories, it usually carries a 20-year bracket, approximately a 20-year bracket, such that a middle-aged person can fall from 45 to 64, 65. An elderly person will start from 65 years and above. And people above 85, 88, 90, we usually categorize them as advanced aged population. So with each of these classifications of our aging units, we'll discover that naturally, nǹkan tó bá ń ṣe lágbájá máa yàtọ̀ sí nǹkan tó máa ń ṣe tẹ̀mẹ́dù, even in terms of clinical presentations and what have you. So if we are going to talk about emotional issues, which the Honorable Prof has already talked about, we'll discover that there is always a recurring cycle in emotional issues. Anxiety would come, depression would come. The triggers may differ from maybe a 45-year-old from an 85-year-old person. The trigger may differ, but nonetheless, the disease spectrum is almost always the same. A 45-year-old may be anxious because of midlife crisis, professional issues, financial issues, relationship issues, and what have you. An 85-year-old will probably develop anxiety, not because he has school fees to pay. Sure, you understand. He's probably going to develop emotional issues from the fact that he's getting lonely. When someone is 95 years old, all his contemporaries have since gone. Babani Koludawa, he doesn't have friends to play with. He doesn't have people to visit. He doesn't have anybody coming to visit. Even the children also have issues of their own. So you discover that can begin to send commands to the body on the rate at which the heart beats, either slowing down or running fast. So the endocrine organ is one of such. And of course, there are other endocrine systems in the body too that fluctuate with the aging process. Another one is the pancreas. The pancreas releases insulin, and insulin is the one that commands our muscles to make use of the source of energy that we have taken into the system. So all of these things would age with time. And this aging process, it cuts across all of these systems. All of the systems can be mediated by environmental factors, can be mediated by disease, can be mediated by the friction of use, overuse, or even underuse. And it begins to be like, if I don't use an organ, it can cooperate to aging processes, or it can decline in function. If I overuse, it can also decline in function. Like I always give examples to my patients. If you decide to sit in one place without doing anything, you begin to increase weight. If you decide to start going to the gym and be lifting heavy metals, you would increase in weight. What's is different. One would accumulate unnecessary useless muscles and fat, while the other ones will pick up more bone density, muscle firmness, and what have you. But the cumulative effect is when the person is clothed, it is only when they rip off, you will now see that one is 6-pack, the other one is 0-pack. But the cumulative effect is there's going to be increase in body size, and that can be translated to weight gain. So other organs in the body that can also fall prey to the aging process is the immune system. The immune system we all know, but just to refresh our mind, it's like the megad of the house. It's like the megad of the community. Where people are coming in who are not supposed to be there to come and cause chaos and wreak havoc. The security system will be activated. So it's the same thing with our immune system too. Our immune system are those soldiers that the body puts up to affect more like a defense line, such that we don't fall victim of diseases, stress, and what have you. So the immune system also gets weakened. And the interesting part here is this: as we get older, all of this functional decline would mimic very young age group. I mean, that's one interesting thing about it. But the main difference is with time, they would firm up and stand on their own. So, such that it shouldn't be too confusing to us that why would a 75-year-old be prone to pneumonia? After all, they said the older we get, the better our ability to fight infection, the immune response. And so why are they now behaving like a 5-year-old who also will fall prey quickly to pneumonia, chest infections, and what have you? It's simply because those age groups are underdeveloped. While the older ones have already, exhausted their ability. It's like it has peaked. The sensory functions of hearing would also be declining. Even the body sensations and what have you, crawling body sensation, tingling sensations, and all of these things will come in. as we age. In some people, it can set in earlier, but for some, it follows that natural aging process. Issues to the brain, to the kidneys. I mean, it is on our organs. Sexual health will also suffer. The odogu in the younger generation, people who are in their 20s, 30s, would put on a firmer crown than someone who is approaching 70s, 80s. I'm not saying that those people at that age can still not procreate, they can. But generally speaking, deriving pleasures from such would reduce, partly because of the hormonal response. For the females, it can come earlier, 38, 40, 45, 50. We call it menopause. For the males, it rarely comes for most of us. And that is why Yorubas in their wisdom will say, Ile obìnrin òkè pẹ́ṣù, Ile ọkùnrin mi kò tí ṣù at 2 a.m. So those are some of those things that can affect this, age group physiologically. Can affect this age group physiologically. There are so many others too, but I would be silent on it. When time permits, during the question and answer time, we shall revisit them. Now, is it a crime to age? It is not. In fact, even if you don't age, we'll be made to understand in Quran chapter 90, verse 4, that man has been created into a state of turmoil. And the more the wala begins to come, whether it is physical, whether it is any kind of wala that we experience, any type of wala, whether it is financial, anyway, it will even come anyway, because nobody would have it easy from the beginning to the end. So it is that state of turmoil that begins to masquerade as that will begin to masquerade as environmental issues, that will begin to masquerade as social upheavals, the loss of someone. I mean, the loss of a dear one can put some people at, I've seen people who maybe 2 months prior, and they were looking very healthy, and because they lost the first child, you just see them, they just depreciate within a very short time. You'll be wondering, kilo shele, until they begin to tell you what the vicissitudes of life has placed upon them. That's why you now appreciate that. So for some people, it is marital issues that will make them to age, faster than expected. So we should understand that all of these things will come. And as Muslims, we've also been reassured countless places in the Quran that we should place our trust in Allah. So once we begin to place our trust in Allah, even if it is a matter of physical issues, and we place our trust in Allah before we start, running after the solutions, we tend to, for those who have experienced it, they will understand that the outcome is almost always better than someone who just dived into the river of life without that spiritual backing. It does help. So we are going to start talking about one or few of the coping mechanisms, irrespective of the age group you find yourself. One rule is to believe that there is a divine hand behind everything that happens to us. So that puts us in this frame of mind that Kagba for long is in it, such that when it comes, we can begin to rationalize it spiritually, that's the way Allah wanted it, before we now begin to seek physical remedies. Staying active, helps all of these systems we've talked about, from the musculoskeletal to the heart to the digestive system. There's no part of the body that will not benefit from LDA exercises. There's no part of the body that won't benefit from it. So that's one good coping mechanism. Everybody would agree that we are a product of what we eat. Such that if you have 2 people fed on 2 different quality of diet, of better nutrition, would most likely have better cognition. Lórí ẹ̀ máa pé ju ẹni tí ò jẹun àlàáfíà lọ. I mean, it's been scientifically proven. And that is why WHO, after back and forth, has decided that the healthiest meal nutrition you can give a growing baby is breastfeeding, is breast milk. Because they know that whatever you feed that child would have an impact on that child, not just physically, but mentally, psychologically, and even socially. Nutrition has a role to play. I had a friend who would always joke that you see all these orisas that behave abnormally, go and check them on breastfeed one kikere. And incidentally, he's not even a Muslim, but he believes that as a medical person anyway, that the nutrition packed in breast milk is the best for cognition. So the same thing too as we age. There are certain foods that are nutrient packed that if we deny ourselves of such, it's just a matter of time. Cognitive function will decline rapidly. Heart diseases will begin to set in. Muscle wasting will begin to set in. And the person will be saying that we don't gel. And when you ask the person, kill and gel, bread at soft drink, boiled roasted corn and palm kernel also. And of course, the person is eating, but it's not balanced. And eventually, Uma reflects the way the person thinks. Uma reflects in the disease spectrum the person will come in, and of course, the aging process of that person will be faster. Social support is very good, especially for emotional issues. And that is why when you see that when psychiatrists, talk to people, there are some categories of, mental challenges, emotional issues that they would rather have them as a court. They would rather have them as a support group. For instance, people who have challenges with, say, drug addiction. I mean, it is better when you come together and you see the next person doing much better, and you'll be like, motivated, feeling initiate that is right. So, especially for emotional issues, psychological, psychosocial issues, social support groups helps. Volunteering also helps. I belong to a group called IMAN, Islamic Medical Association of Nigeria, and I discovered that each time, of course, during Ramadan, each time we go on medical missions to prisons, to the underserved communities, there are some very old people who are in their 70s and close to 80. They will still follow us. And initially I was like, what is the motivation for these people? But with benefit of hindsight and, of course, better education, volunteering helps to release this dopamine. It has this dopamine effect on people that just give them this feel good, feelings. They just feel at peace with themselves. Just volunteering their time, their money, energy to help others. So it's one way to help with these coping mechanisms. Mindfulness, practicing of mindfulness. There are people who, especially females, and you'll be wondering, you have this breast lump, and you'll be like, hey, I want you to notice the land on you, and you are feeling it, and you say, this thing cannot be, I've been there for the past 2 years. And they just tell you casually, I want money. I mean, how can you have your body and you are not conversant with your body? How can you have a body and your body is giving you warning signs and you just disregard it? And you'll be like, hey, no. People can have headaches for different reasons. But when you are deprived of sleep, the kind of headache you would have will be different from the kind of headache you would have when you are hungry. It's going to be different from the kind of headache somebody would have when he's having a warning sign for cancer of the brain or tumor lesions in the head. I mean, they are going to be different. It's not the same kind of headache you would have when you want to have malaria. So when somebody would have certain headaches that is traceable to a bad eyesight, and the person will just tell you that, oh man, now, you feel that this person is just being careless with his or her health. So we need to practice a bit more mindfulness, being aware of our circadian rhythm. The circadian rhythm is just like saying at certain times of the day, your body speaks to you. So it is your duty to listen attentively and respect whatever warning signs and take actions on what the body is saying. To repeat that cycle once, twice, thrice, and I'm sure after a while you get calm. If you are not calm, please make sure that you contact your medical practitioner. Regular checkup also helps too. Unfortunately, most of us, it is when the body is down that we visit doctors, we visit the clinics or the hospital. It's not really the best. The hospitals, the doctors, the health practitioners are not just there to manage diseases. In fact, they are one of the best people you can confide in. And somehow, by virtue of training, experience, they can actually serve as good counselors. And they are readily available, unlike, say, a religiously minded or trained imams, for instance. So we can take advantage of that. Cognitive restructuring, developing good social skills. There are people from young age, they don't mingle, and they will tell you that they don't have any circle of influence. Okay, let me just be going as one man riot squad. But they again too, as they get older and life begins to happen to them, they have no social support to fall back upon. And their family in their old age. The gift of look away is also very important. Very, very important. I'll give you an example. You have two siblings. One works in the market, carrying kaya. One works in and all like that. The other that is sending his own children to a 5 million naira per term school. And the other person feels that because we are family, so my own children too should. The person is now using his hand to pull that person is just only adding more stress to himself. So Umawareni is also part of the coping mechanisms. Indeed, listening to the Quran, recitation of the Quran, scientifically proven, not because I'm a Muslim, but scientifically proven, is being proven beyond doubt that when you recite the Quran and you expose elements of nature to it, they tend to be in a calm state, including the water we drink, saying our prayers before we eat. You'll be shocked that it has a whole lot of benefits. And when I mean benefits, I don't just mean spiritual benefits, physical, clinical benefits. I always cite this gentleman, he's late now, Professor Rustum Roy. He did a whole lot of work on material science as it involves prayers, the positive effect of prayers, recitation of the Quran, spiritual chants in nature, in water. And I mean, you can read all of those things up or watch the YouTube videos, they are everywhere. And finally, it is good to meditate. It's not just enough for us to read a passage of the Quran, for instance, without meditation. Because when you meditate, you tend to get the essence of what we read. And it has its spiritual, physical, and health benefits. The reason why I have to quickly, talk about this is that there are a whole lot of meditation techniques that, if care is not taken, will be inviting unwholesome spirits into the homes. But fortunately, as we have scriptural texts that can invite positive vibes into our lives, especially when we sit, we meditate on all of those things, and we read. Just as a takeaway, there is I've forgotten his full name, but one of his name is Silver. He was, I think, an American-Mexican or so, who developed what is called the Silver technique. I would implore us to do a bit of read up about it, even if you don't understand the full context. If we can take one or two learning from it and apply it and modify it to fit our own to pick our creed as a Muslim. For instance, finally, for instance, when we have difficulty in sleeping, the man proposed that we can do a countdown from say 10 to 0, 50 to 0, 100 to 0, and amazingly it works. So instead of popping pills, one of the most abused pills to sleep is, I'm not sure, I think it's Piritin. There's this other one that they use for appetite, cipreptadine. There's a popular name for it, I've forgotten. Instead of popping out of those things for us to sleep, we can engage in those little things that will not cost us money, that will not have a negative impact on our physiological system or disrupt our bodily functions. And they've been proven to work effectively. Jazakallah khairan for giving me the privilege to give you this small talk. Apologies, I'm a very disorganized. I should have done a slide presentation, but again, to that probably said those who are in the academic fields, apart from those of us who are in the private practice, for the medical, for those who are in the academics, they're a little bit, prim and proper at dotting their I's and crossing their T's. I hope the few minutes we spent together has been beneficial. Thank you. I hope I've not broken it.
Two questions here, two questions here. Because of my joint, because the reason say to that so we can still pay that 15 to 20. That's why we are taking just one questions. But if you know the important issue, you will learn already. So you can take one more than the only people I'll take one questions from also what are the questions for a second lecture? With regards to this nuclear and nuclear deportation, I want to focus on that. May not be lastly, the sister was brought and has two daughters. The last one was 13. 13 years ago, had a divorce. Said, for once, never had a sex after that 30 years.